Hey everybody, Dr. Sis here. So today we're going to talk COVID numbers, all right? Because the COVID numbers are everywhere. So if you remember, travel back in time about 7 months ago, the projections from the Imperial College was that 2.2 million Americans in America were going to die, right? And now the numbers have changed. Now we just keep counting cases. And where I live in my area, we are in a severe pandemic right now. So I want you to imagine a pandemic that is so severe that over 7 months in a county of 118,000 people, one person has died. One person. I looked it up. In the past 30 days, about 160 people have died in this county, which means in this year, it's fair to say over 1,000 people have died in this county, and of that, one person died of COVID. Around the world, the average age of a person that dies of COVID is over 80 years old, which is 2 years older than the life expectancy in America. So on average, people around the world are dying from COVID older than the average American lives in the US, right? These are the numbers we are terrified about. One death, almost 7 months out of 118,000 people. Working class, for probably the person watching this video, working class people, your chances of dying from COVID are about the same as your chances of getting a car accident and dying on your way to work. For kids under 15, right? Kids under 15, schools are closed, sports are closed. The odds of them dying of COVID are less than getting hit by lightning multiple times, right? Those are the numbers. I'm gonna go over some numbers that are far scarier to me, that nobody talks about, and I think we need to talk about. It's so important, and it ties all of this together. But right now, it's all about cases and then tracking people who are by someone who's tested positive. And we full know that for every positive that has been tested, there's 5 to 10 people that are positive that just didn't get tested. And it's like, to me, what's the end game? Right? All I keep hearing about is mask, any mask, cotton mask, polyester mask, tri-blend mask. Doesn't matter if you're wearing an hour, 4 hours. What if you don't wash it for a day? What if you don't want? What if you touch your face? What if you scratch your nose? What if you sneeze into it? You still, I mean, no details other than a mask, and it's gone from slowing the spread to now these masks are going to stop the spread. And then how do we know when the spread is stopped? What's the end game with this? Like, what is the end game? How long is this going to go on for? Forever? Is this the new normal? Or are we waiting for the vaccine? Is that the magic thing? Once the COVID vaccine comes out, we're all saved. And they're going to give a COVID vaccine to everybody. Is that the goal? Are you going to give a COVID vaccine that damn well they all have side effects that can hurt you to a kid that's under 15 years old to protect the people that are over 65? Let me ask you this, have you ever looked into the effectiveness of the flu shot for people over 65 that's been around for decades? I mean, the high-risk people are above 65, yes or yes? Okay, let me read this to you. This is from the Cochrane collaboration. This is the gold standard in research, by the way. The available evidence relating to complications, this is of the flu shot, is of poor quality, insufficient, or old, and provides no clear guidance for public health regarding the safety, efficacy, or effectiveness for influenza vaccines for people aged 65 and older. But you're going to trust a COVID shot that's mass-produced in a very short period of time with no long-term safety testing? It's like, why did they come up with a quadruple dose flu zone for older people? Because the flu shot doesn't work. So like, well, let's give them 4 times as much because maybe that'll help. Is that the end game? I mean, that's crazy to me. Let's go over some statistics that are gonna blow you away that nobody's talking about. And then we'll get the solutions to the problems that you're gonna see, which is the solution to COVID and the future coronaviruses, rhinovirus, influenza viruses that come. All right, so this is insane. In the 1960s, about 1.5% of kids had a chronic disease. Today, it's at 52%. Think about that. 1.5% of kids, now over half of kids, have a diagnosed chronic disease. Now, I will admit that this number is probably inflated because today, doctors are much more likely to label a diagnosis and give medications, which in itself is a problem. But this number, which next to nobody knows about, is terrifying. Another terrifying number, obesity. Obesity isn't overweight. Obesity is really overweight. 40% of adults, about 20% of kids. And this number, I bet you it's higher because this is based on BMI. If we did body fat percentage, I would bet any amount of money that these numbers are even higher. 1 in 5 kids is obese. That is such a huge problem. What does obesity lead to? Lower immune system, diabetes, depression, aches and pains, or at least that, what is it? Multi-system inflammatory syndrome. Have you heard that? COVID can lead to multi-system inflammatory syndrome. What does that even mean? Multi-system, a bunch of systems. What is that? Your cardiovascular system, vascular system, respiratory system, right? Inflammatory, inflamed, and then always you gotta add syndrome on the end because that just sounds better. So what does it mean? Your whole body's inflamed. What causes chronic inflammation? I'll show you. Diabetes. 41 million Americans, about 1 in 8 have diabetes. That's a huge, huge problem. And one thing with diabetes, like some people are like, well, there was a 4-year-old that died of COVID and he was healthy. It's like, yes, sometimes some people react to others. It sucks. It is what it is. There's about 200 people fell off horses and died in a year, right? I mean, 60-some people die per year because of bee stings. It's like, it sucks, man. It sucks, but you have to look at the overall. Okay, so diabetes. People are like, well, have you ever seen anyone on a ventilator? And have you ever seen anyone get their legs amputated because of diabetes? I watched my neighbor, legs amputated in a wheelchair, obviously, and then they gave him a new pad for his wheelchair, which gave him a sore on his butt, but he couldn't heal well because of the diabetes. It festered and that killed him. Like I've seen people with heart disease who had the surgery and they bleed out and they're stuck in machines for days trying to keep them alive. I mean, any death is awful. It's all awful, but this stuff, it's just because it takes time, we're not as sensitive to it. Think about this. On average, 40% of kids right now are gonna develop diabetes because they're poisoned with garbage foods, right? That's what it is. 378,000 people this year already have died from heart disease, which is what causes heart disease. Our choices, which we'll get to. Digestive issues. Over half of Americans have digestive issues. So like drugs like Humira are the top selling drugs right now. Do you think what we eat has something to do with how our digestive system feels? So what causes all of this stuff? What is the leading causes of all of these chronic illnesses, which cause the comorbidities, which is what the majority of 80-year-olds have that die from COVID? It's not just people over COVID, over 80, pretty much all of them have comorbidities. What causes this stuff? Education, poor nutrition, exercise, environment, right? We aren't taught the way we should be eating. We aren't taught how important good food is for us. And a lot of the education out there, I see it depends on the university, man. It depends on some nutrition universities. You can tell their books are from government agencies because they're awful. Like they're teaching such antiquated, poor information because so much of this stuff revolves around money. If you think our government actually has our health as their number one interest, you're out of your mind, and I'm going to show you how here in a second, all right? So we have to start focusing on this. So here's what happens, watch. We eat terrible foods, we don't exercise, we get these diseases, and then what does this cost us? On average, every single person spends $11,000 per year on healthcare. And you'll be thinking, oh, not me, there's no way. Yes, you too. Now, if you live to 78 years old, that means you'll spend $858,000 in your lifetime on healthcare. And this is if it stays, which it never does. It goes up very, very fast. You're gonna spend well over $1 million on healthcare. It's like, well, how? Because it's coming from so many places. Portions of your taxes go to healthcare. Your employer pays extra taxes on top of your salary that goes to healthcare. When your employer pays for your health insurance, you know where that comes from? Your salary. So instead of getting $50,000 per year, they're gonna give you $40,000 so they can pay $10,000 to your health insurance, right? Healthcare money comes from so many places that's not tangible. You don't feel it. It's not like writing an $11,000 check everywhere, but you're paying it, right? That's the system. It's so crazy. So we're eating terrible foods. It's costing us a fortune. And our healthcare on average in the world, our health on average in the world is terrible. Now look at these numbers, right? Here's what your government does that cares about your health. They take $22 billion a year of your taxes last year, of your taxes, to pay farmers to grow corn, wheat, soybeans, and cotton. The foods that make the processed junk foods that make us sick, fat, and diabetic. That's why these foods, junk foods, are so cheap, because they take your tax dollars and pay farmers to grow it. That's why low income areas and these people that have don't have access to quality food is because they're supplied with the garbage foods that promote this. That's our system. That's our government system that cares so much about your health. But it gets worse. The government gives out $68 billion a year in food stamps, and with food stamps, people can buy any of this junk. You can go buy soda and chips and cookies and crackers and muffins. So the government takes taxes to grow and create junk food and then gives money so people can eat it and develop the chronic conditions that they need to go to the hospitals to get treatment for, right? So what do these treatments cost? Medicare, I'm going to skip this one. Medicare costs Medicare and Medicaid combined, $1,348 billion in a year to treat this, right? Now look at school lunches. Wouldn't you like it? Like, if you ask, and I've done this, I always ask teachers, like, hey, do you eat lunch at school? It's one of two answers. Oh, God, no. Or, it's getting better. You know what the answer should be? Hell yeah, the food's amazing. We can obviously afford it. So right now the government pays $13.8 billion towards school lunches. We're spending trillions of dollars for this COVID thing going on. All this money spent on Medicare and Medicaid. If they really cared about health, don't you think they'd spend more money on getting kids good food? Now, over here, remember I said education is the most important thing, right? The government spends $189 billion on education per year and $1,348 billion on Medicare and Medicaid. The thing is, the government is not about your health, right? Think about it. How many times can they be wrong? Remember when they told you to eat margarine and not butter, right? And for years and years and years, don't eat fats, you gotta eat this margarine. Like, oops, margarine is so bad, it's killed tens of thousands of people. Decades ago, right? I'm getting old. Decades ago, I was telling people, eggs are fine. Don't worry about eating cholesterol. The evidence is clear. Like, oh God, I can't eat an egg. An egg's gonna kill me. I'm gonna go eat my refined grain cereal because that's what the government says, right? For years, the government told you not to eat eggs. The government will tell you to eat a non-fat Pop-Tart, but avoid salmon because it's too fatty. It's like, why do we trust these people, right? Who's Congress's top lobbyist? The pharmaceutical companies, right? Why do pharmaceutical companies give money to congressmen? Just to be nice? No, it's because they know they're going to influence their decisions that are going to benefit them so they can sell more drugs and put out more garbage information and get people eating more garbage food. And it's so crazy right now. So like, mass, everything's all about mass, right? So there's obese kids drinking Mountain Dew and eating chips, and if you're like, hey man, you're poisoning that kid, you're a fat shamer. Right? When you're trying to like point out the dangers of poisoning kids with soda and chips and it's this commonplace here, you're a fat shamer. That's how crazy it's gotten right now. Like, that's how brilliant this whole garbage marketing system is. Like, think about this. The foods that you would never give a dog. You would never give a dog Mountain Dew. Pepsi, animal crackers, cookies, mac and cheese, frozen pizza, lasagna, pasta, all the garbage that we give ourselves and kids on a regular basis, we would never give to a dog. That's what should be the focus. The biggest frustration to me is everything is about running around wearing a mask, any material, just as long as you have a mask on, you're stopping the spread, which you're not stopping the spread. It's insane to me if they don't bring up this stuff with it. This is the big problem. So what can you do? What can we do? Stop listening to the freaking government and the mainstream media. Like, how many times can they be wrong? And here's what's crazy to me. The health in this country is terrible. And you still take advice from the people that got us to this place. That's insanity to me, right? What can you do? You gotta take control of you first. Focus on you and your kids, right? Buy good foods for you. Cut out the sugary drinks for you. Cut out the junk food for you. Lead by example and be a good role model for your kids. People ask me, well, how do I get so-and-so? Lead by example. Focus on you. Take control of you. It's empowering. Here's what's gonna happen. You're gonna, once you take control of you and your own health, right, you feel better, you look better, your confidence goes up, your diseases go down, your medications go down, you actually save money for sure. One thing, if you follow a lifestyle I teach and practice what I preach, is, this should be frustrating. A lot of people, they're spending way more than $11,000 per year on healthcare. Where's it coming from? Healthy people's pockets, right? We have to pay for other people making bad choices, which is frustrating, but there's nothing you can do about it. What can you do? Stay empowered and take care of you. Now for me, I practice what I preach, right? Some people like to attack me like, I'm just putting out the information, right? Here's the deal, man. I practice what I preach. I remember when I was in my 20s, people were like, oh, wait till you hit 30. When I'm in my 30s, wait till you hit 40. I feel great, right? I do what I recommend. I feel amazing, right? I'm confident. I can see the muscles I want to see. My body feels good. I have good bowel movements. I sleep good. I have good relations. It's a really good life to live. Here's what's hard. Hard is carrying around 50 pounds of extra weight. Hard is having achy joints. Hard is having chronic pain. Hard is having digestive issues. Hard is being constipated. That is so much harder than just eating good foods, getting outside and moving, right? So hopefully what this video does is inspire somebody. It's like, you know what? I'm gonna take control of my own health. I'm done with the sugary drinks. I don't need that crap. I'm gonna eat fruit and vegetables every day, just fresh fiber first every day. I'm just gonna drink water, right? I'm gonna cut out the processed foods. Once in a while, wedding, I'll let loose. Graduation party, I'll let loose. Everything in between, I'm gonna live healthy. Healthcare providers, calling you out. How about we get the junk foods out of the hospitals? How can you possibly go into a hospital break room and drink a soda? It's a freaking healthcare facility. I will never forget when I was in the cardiopulmonary floor as people are dying of heart, literally bleeding to death, hooked up to machines, dying from heart disease, watching nursing staff walk around with Mountain Dews. Blew my mind. Completely blew my mind. Like, the disconnect is so crazy to me. How can we commonly do the things that cause this, right? It would be like smoking in front of someone that's getting lung cancer treatment. It's just, it just doesn't make any sense to me. So us health professionals lead by example, parents lead by example, and let's take our health, take control of our health and start from the bottom, because there's no way the government has our health and our best interests in mind.